Yeah, consumers really are looking for a digital experience like they get from retailers, online retailers, and what e-commerce, what they get from banks and financial services. And healthcare has a long way to go to catch up in some respects there.
Hey gang, it's Tuesday, January 18th. Lisa and listeners, welcome to the Behind the Numbers Daily and eMarketer podcast made possible by Smartly.io. I'm Marcus, and today I'm joined by our principal analyst who heads up our digital health practice. It's Lisa Phillips.
Hi Marcus, thanks for having me.
Hello there, thanks for hanging out. We start, of course, with the fact of the day. Today's fact: many of history's biggest disasters are caused by lack of sleep. The Exxon Valdez oil tanker that spilled 11 million gallons of crude oil into Alaska's Prince William Sound in 1989, the fatal US Space Shuttle Challenger accident that occurred in 1986, and the Chernobyl nuclear disaster that occurred the same year, all were caused in one way or another by exhaustion and lack of sleep on the part of the men who were responsible for preventing such disasters. That's madness. So I went down the rabbit hole of sleep facts. So I've got one for you. National Sleep Foundation guidelines advise that healthy adults need between 7 and 9 hours of sleep per night. Are you getting that much, Lisa?
All at once, maybe, if I'm lucky. If I'm lucky.
I think they're recommending all at once. Although it's funny you should say that, because for our giraffe listenership, you guys are fine. This doesn't apply to you. Giraffes only need between 1 to 4 hours of sleep each night. And giraffes who are born in the wild, they only grab like 5 to 10 minutes of sleep at a time. Koala bears, however, so lazy. They need 20 hours a day. But they're extremely adorable, so they can do what the hell they want.
It sounds like domestic cats.
Right. Yeah, they're definitely up there. Today's real topic: the key healthcare trends of 2022. So Lisa, today we're talking all about digital health trends to watch for in 2022. A new report that your team has put out. Digital innovations expand access to healthcare at home, in stores, and on the go. We're going to pull two trends from that report. There are many, many more, so check it out if you're a pro subscriber. But we'll start with primary care going retail. What do we mean by this, Lisa? What's this trend for 2022?
Well, it really is a perfect example of what we as a team decided this year. It's all about access to healthcare. And one of the biggest trends is that retailers, CVS Health, Walmart, and Walgreens in the forefront, are really diving into primary care and are trying to offer it in their stores. They're going into telehealth. Walmart bought MeMD or MeMD last year earlier, and they're setting up clinics. CVS Health has announced it's going to close 900 stores over the next 3 years and turn some of those into primary care clinics. It's been rolling out health hubs where doctors, or actually nurse practitioners are, but now they're going to start hiring real doctors. Mm-hmm. And this trend is really based on trying to get people to come into their stores. Just because in its fourth quarter call just this week, CVS announced that its retail sales in the fourth quarter shot up because so many people were coming into its stores to get COVID booster vaccines against the Omicron virus. So these stores are seeing healthcare not as a loss leader so much, but as a way to get into the business. Consumers are liking it because even if they don't like telehealth, they do appreciate they can go online. They can just call CVS, Walgreens, get somebody on the phone, do a video call, schedule a visit if they need it. And it's way closer than their doctor's office or the local hospital. And it's way more convenient.
What's the biggest challenge for these retail clinics in terms of trying to move, these retailers trying to move into the world of healthcare? Because it seems like there's a lot that they're doing right, whether that's access, whether that's the just abundance of these retail stores in or around the local area, the times of day that they're open. What's the thing that's holding them back the most?
Right now, it's a labor shortage. Pharmacists quitting and leaving because they're just so frustrated and upset about, they're being under such pressure with the coronavirus surge that we're in right now. But really, it's the money. because you can't just have people come in willy-nilly. I mean, you have to have an electronic health record system. You have to be able to take all kinds of insurance because, of course, they're not going to give this care away for free, although they do want to make it, as low cost as possible to keep attracting patients. Again, it's the digital technology that's behind it that costs money, as well as hiring doctors.
Right. Surprised to see, though, Lisa, the US retail clinic patients, we have some numbers on those folks. US retail clinic patients from 2020, 63 million. That was up 10 million from the year before. So 2019 to 2020, it jumped 10 million. So 63 million by 2020, 67 the next year, so up 4 million, and then up a couple of more million this year, but that's really kind of flattened out. I mean, you're talking about a quarter of the population who are going to be US retail clinic patients this year. It was about a quarter last year, pretty much a quarter the year before that. It's not growing as fast as I would have assumed, given that we're saying that primary care is going to be going to retail.
Well, there's still the matter of trust. And do people really want to, do they think they're getting the same quality of care that they would if they went to see their doctor? Now, baby boomers, they trust their healthcare providers. They trust their doctors. They'll go to clinics if they need to, if it's an urgent matter. They do like the convenience and the, not so much time traveling. But it's really Gen Z and the millennials who don't have primary care doctors right now. They're the ones who are really using the retail clinics. But we revised those figures actually upward later, I guess I want to say late in the year of 2021. And that's when CVS afterwards came out with its, we're closing stores and we're going to really open up way more health hubs and minute clinics.
Right. These numbers from January 2021, so a year gone by, these numbers, likely to look a fair amount different today. You talked about attracting new patients and the element of trust. It seems one way to attract them is digital experiences. In your report, you note consumers aged 18 to 54 are at least 4 times as likely as consumers ages 55 and older. So if you're 54 and below, you're 4 times as likely as those 55 plus to consider switching doctors if their practice doesn't offer digital experiences like touchless check-in and virtual care, according to CEDAR. Your thoughts on the influence of digital here and how much that can entice people from their existing doctor to a new one?
Well, the demographics there, I mean, people age 55 and over, let's just say you hit 65 and you're on Medicare, you may be limited in the providers you can tap. So that's kind of a built-in. But yeah, I think that we've seen other reports like from Redpoint Global, as well as this, what you just quoted from CEDAR, is that, consumers really are looking for a digital experience like they get from retailers, online retailers, and what e-commerce, what they get from banks and financial services. And healthcare has a long way to go to catch up in some respects there.
They've come to expect it from other industries. That's a fair point. Let's move to a second trend here. Home versus the hospital of the future. What are we talking about? Oh,
this is one I've loved for a while. What we're talking about is that inpatient care is moving outside the hospital. Hospitals have, traditionally lived, their business model has been how many heads in beds do we have? That's how they get paid. But insurers are finding, or insurers want to put patients in lower cost settings. So if there are patients who have had an operation, as we were already seeing with joint replacement, hips and knees and so on, people can go home the same day. But some need really, more care at home. So there's this program called Hospital at Home that a lot of really major health systems have joined. It's from the Centers of Medicare and Medicaid Services, which we call CMS. And they're really pushing patients out back home. And they get remote patient monitoring devices, which we'll talk about more later. But they also have caregivers who come by, take care, do their blood pressure, check their vitals, to, check their lung capacity, et cetera. And so home health agencies, that whole market just on the side is blowing up with mergers and acquisitions. Private equity is really trying to get into that so that they can get a piece of this hospital at home pie.
Are there one or two, I'd say trends, but I think I'm more talking about news stories, mergers, companies, deals, initiatives that are really pushing this forward, this home versus hospital trend?
Well, there have been. deals like, I want to say back in late 2018, when there was a big company called Kindred Healthcare that provided long-term acute care service, but home health options and skilled nursing. They got acquired by Humana, which is a major Medicare and Advantage insurer, and two huge private equity firms, Welsh Carson Anderson and TPG. That was a $4.1 billion deal. That has since been spun off. Humana acquired all the home health parts of it. It's one of the things that really that's a big deal I could point to in home health, but there have been so many. What's really happening is, again, a labor shortage is a big problem for home health workers because wages are low. And if you can now make $15 an hour at McDonald's, why wouldn't you? As opposed to, 8 or 10, doing real hard care. But that said, hospital at home is probably going to be around for a while, but to get back to the digital aspect of it, they really need to have more remote patient monitoring devices and data collection so that clinicians can see, almost in real time whether a patient is heading for a medical crisis at home or not.
Right. Are there certain conditions which you think will make up the bulk of the at-home patient monitoring? So certain things where you're saying, okay, you can use these devices, certain conditions where you can say you can use these devices, go home and be monitored more so than others?
It depends on the acuity of, the patient's condition. If it's just going to be, a heart monitoring device, yes, there are plenty of people walking around with those or staying at home with those now. It also depends on whether the patient themselves, like really seniors or what they call the old, can they really hold a tablet? Can they see well enough to do some of these things? So it's hard to say.
Yeah. That's what we've got time for the lead story. It's time now for the halftime report. Lisa, I'm going to ask you for one takeaway from each of your two healthcare trends we discussed in the first half. We were talking about primary care going retail and home versus hospital. Your key takeaways for each of those trends are what?
Well, I'll just say the lines between healthcare and retail will blur even faster in 2022. That's pretty obvious. And I'd say for home health, it's going to be like no data, no dollars. Unfortunately, reimbursement right now for these hospital at home programs is run by CMS, which obviously oversees Medicare and some Medicaid programs and rules and regulations. And if things aren't working out to where we're getting better value for the money that's being spent there, then these programs are going to be cut or put into a different agency, I think, under a different rule.
The report's called Insider Intelligence's Digital Health Trends to Watch in 2022. Digital innovations expand access to healthcare at home, in stores, and on the go. If you're a Pro subscriber, check it out. There's plenty more trends in there. That's all we've got time for the lead. Time now for In Other News. But first, a quick word from our sponsor, Smartly.io. Hi to all you social media marketers out there. Listen up. Social platforms have become more important than ever for brands. You know this. So if you're looking to scale your social advertising in 2022, look no further. Smartly.io is number one in social media advertising. They help brands automate every step of the process by combining creative production and ad buying to unlock greater performance. To get the brand new 2022 social advertising trends report, go to smartly.io/eMarketer. Folks, we are back today in other news. Do-it-yourself healthcare and a new category of consumer biowearables. Story 1, the new trend in healthcare, do-it-yourself. With doctors under strain in the pandemic, patients are taking more of their healthcare into their own hands, writes Betsy Morris of the Wall Street Journal. Miss Morris goes on to write that frustrated with an overburdened healthcare system, more consumers are turning to gadgets, home kits, apps, and monitors for tasks and tests previously handled by trained medical workers. Folks are monitoring their own blood pressure, conducting EKGs, tracking blood sugar and cholesterol levels, even pricking their own fingers for blood tests. So Lisa, the new DIY healthcare trend is blank.
Is booming. It's taking off thanks to COVID, where people are now used to doing at-home tests just to check to see if is it a cold or the coronavirus. So that's really brought the public's attention to this, that, oh, I can do this at home. Also, we've seen ads, perhaps, depending on what channels you watch on television. Cologuard. Your doctor can prescribe sending you a colonoscopy in a box. Not exactly, but you mail it back. PCR tests for coronavirus people are used to mailing back. So this is a real trend. The only issue is doctors are worried that people will misdiagnose themselves, misread the results, and jump to the wrong conclusions, and then make even worse decisions.
Yes. Yeah, it's going to be a very fine line to balance, or fine line to walk. One of the two. But yeah, between how much you can do at home and when is the right time to come in and see a professional. Story 2. Abbott Laboratories made CES history when they presented a keynote at the most influential tech event in the world. The first healthcare company ever to do so, notes a PR Newswire article. At the annual tech conference, the Consumer Electronics Show, Abbott announced it's developing a new category of consumer biowearables called Lingo. Lingo is designed to track key signals in the body, like glucose, ketones, and lactate, to help people better understand their general health and take action. Lisa, first of all, I'm going to ask you to describe what this even is, this biowearables category, if you will, and then what they mean by Lingo. And then this announcement from Abbott Labs, in your opinion, is blank.
It is part of a trend of fitness trackers. Health and wellness, they're really trying to get ahead of even Fitbit and the Apple Watch, although Lingo isn't going to do it. It's all part of the, quantified self movement, where people want to know what's going on with me. You mentioned sleep in the beginning, and I mean, there are sleep monitors out there. There's all kinds of, things going on. What people want to know much more about their health, their welfare, their well-being as a result of COVID, too.
Mm-hmm. It seems like Lingo is a platform, right?
Yes, it is. And it's not meant, this is what makes this a real health and fitness thing, because these are not medical devices. They are not meant to be used, by a doctor to diagnose anything. So this is a market that is just exploding now. Abbott being a real, biotech-focused company, they're trying to get in on much deeper into this with these biosensors and biowearables. Apple Watch can track maybe, whatever's on your wrist. These guys, they're really trying to sniff into your body.
Yeah. Well, that is all we have time for. Thank you so much, Lisa, for hanging out today.
Oh, my pleasure.
And thank you to Victoria. She edits the show. And thanks to everyone listening. Tune in tomorrow for the Behind the Numbers Reimagining Retail, the eMarketer podcast made possible by Smartly.io.